guys, it's time for another Did You Know with Dr. K. Today we're going to be talking about hair loss. We're going to cover different types of hair loss that exist, what it looks like, available treatments, types of surgeries, and how you can get help. So if you look here on the first example, it's patchy hair loss. So a type of fungal infection called tinea capitis could cause hair loss in localized regions. Often it's going to be like circles where the fungus is, and it spreads in that circle form. There's also alopecia areata, which is an immune system problem where the immune system attacks the hair follicles. So that could be like patches that will fall out. People that like to keep their hair in really tight braids, in the long run, that traction can really cause hair loss. Also, let's say you have a certain tick where you're always like playing with your hair, spinning, pulling on it. Well, in the long run, in those areas, you could have hair loss that is localized where you're doing that motion repeatedly. The classic hair loss is male pattern baldness, which would be called androgenic alopecia. It's the classic hair loss where, like, I'm starting to have your hair pushes back here and all the crown loses your hair. You just remain with like the back part of the hair, which is not affected by the testosterone. Androgenic, meaning male hormones, is when the testosterone's active form really attacks the hair follicles. They'll become smaller and weaker as time goes by, and eventually the hair will be thin and will just stop growing. We also have this type of baldness in women, but usually it won't be as pronounced. Like, it won't be a complete loss of all the hair, but the hair will become weaker and thinner in those areas, in the same areas that the men usually lose their hair. There are many other causes of hair loss that are possible, so it's really important that if this starts, that you consult your doctor, because certain medication that you can be taken, certain vitamins, minerals, lack of these could cause hair loss. There's certain diseases and infections that can also cause hair loss, like if your thyroid gland is out of whack. That could also be a cause, so really consult your family doctor before doing or trying anything, because we want to make sure there's nothing else behind going on that needs to be checked out. Different treatments that are available. We have topical treatments of minoxidil, either 2 or 5%. 2% is like a liquid that you would put in the hair and rub it in. 5% is in the foam. I personally find the foam one is a lot easier to use because it's easier to apply and to spread. There's also tablets that exist. So finasteride, spironolactone are the two main ones that you really have to speak to your doctor, because depending on the patient's profile, we'll choose one or another. Usually we don't just stick to one treatment, so it's usually 2 or maybe 3 that we use at the same time to really maximize the effect on the hair. So there's also low-level lasers that can stimulate the hair follicles and reduce inflammation of the scalp that will help maintain the hair. There's also platelet-rich plasma injections, so the donor will be yourself, and that will be re-injected into the scalp. At the beginning, it's done multiple times a year, but as time goes on, the frequency will diminish, and that really helps stimulate the growth cycle of the hair follicles and will help regrow hair. And then you have classic cosmetic options. So there's like hair thickening shampoos, you can have wigs, different hairstyles will help like hide the baldness. If it's well done, usually it can be more aesthetic. There are different surgeries that are available, so that you really have to see a doctor that specializes in these types of surgeries. There's been a lot of progress in the past 30 years. The old school would be like to remove parts of the scalp and like bring it up to where the hair is, or remove parts like flaps that would be put somewhere else. But the newer, more effective methods are really follicular unit extraction, where you go get the small hair follicles in the regions that's not affected by the testosterone, and we move it to the areas where there's hair loss. When that's done, you usually have a good 90% of them that will remain, and then after the initial fallout period, it will grow back and look natural, a lot less scarring than the other methods. So really, if that type of grafting is interesting for you, consult a specialized doctor and they'll be able to give you more information on what's possible for you, because depending on the density of hair that you have in the back, if you have enough, well, you'll be able to maintain a nice visual look in the back where they take the grafts, and then be able to fill out the top portion. So hope you enjoyed this video. Don't forget to like and follow. Have a great day.